So in the vaginal and in the cesarean section, we have separate codes. As you're aware, to bring forth a delivery or to deliver a kid, it's going to be in various stages. So we are going to divide that as three. One is the antepartum, intra-partum and the postpartum. Prior to delivery is the antenatal care or the antepartum services that the physician is rendering. And then at the time of delivery and after delivery, we say as a puerperium, which is 6 weeks from delivery. But postpartum period extends even beyond that. Any complications that develop after this delivery, we categorize that as a postpartum complications. So you should understand here, typically in our country, how it is like, if it's going to be the first baby, what happens, the antenatal care will be taken care by the doctor in the mother-in-law's house, whereas the delivery and the postnatal care will be taken care by the physician in the mother's house. So you will have to report it properly because we have specific codes only for antepartum care. That depends on the number of visits, say like 3 visits, 5 visits, 7 visits. So exclusively for antepartum care alone, we have a special codes, and then for delivery alone, where the doctor is only doing a delivery, and postpartum care alone, we have separate codes. All three can also be clubbed together as a global. It's a routine management of pregnancy. It's a routine management of pregnancy where the entire services can be done by one single provider. In that case, you'll have to report the global code for that provider. So this is common for both the vaginal and cesarean delivery.